I'm Ann Coons, and I'm the President and CEO of the California Children's Hospital Association. Thank you for joining us. Every year, our hospitals provide specialized care to treat children and young adults with the most serious and life-threatening diseases, and are also some of the nation's premier pediatric research centers, making scientific discoveries that benefit all children. For the past 2 years, our hospitals have been on the front lines of treating serious pediatric COVID-19 cases. They have seen how our youngest and most vulnerable children have been impacted by this virus and its broader impact in our communities. Just since January 8th of this year, the number of confirmed COVID-19 cases among children in California grew by over 500,000. Today, almost 1.4 million children in the state have now had a confirmed case of COVID, and children now account for over 18% of all COVID cases in California. Joining me here today for this important discussion is Senator Alex Padilla, who has long been a champion for children's health. He's been a staunch advocate of the Children's Health Insurance Program, or CHIP, which has been a vital source of coverage for low-income children in California. He's supported efforts to provide COVID relief to the state through the CARES Act, and he is currently the Senate sponsor of the Pediatric Access to Critical Healthcare, or PATCH Act, which would strengthen the pediatric workforce, support investments in telehealth, and add critical care capacity for children's hospitals across the country. I'm so pleased that he could be with us here today. Welcome, Senator Padilla.
Well, thank you, Ann, for not just your introduction, but for the years and years of partnership and for the great work that you and all children's hospitals do throughout California. Now, I want to begin by thanking all the doctors, the nurses, and staff of the children's hospitals that are part of your association working throughout the state. You have literally been serving on the front line of the pandemic for more than 2 years now. And I know I speak for the entire community when I say we're inspired by your commitment to protecting our youngest Californians. So we're here today to talk about how families in California can help you by making sure that all eligible children are vaccinated and boosted, those that are eligible for the booster. California, I'm proud to say, has led the way on COVID-19 prevention and vaccination since the very beginning of the pandemic, starting with the strong, bold leadership of Governor Newsom. And I've tried to do my part, not just as a Secretary of State earlier on in the pandemic, promoting good science-based information, but particularly now as a U.S. Senator. In fact, our historic vaccination efforts made possible by the resources delivered in the American Rescue Plan has covered more than 3/4 of adults in California. The helping craft and pass the American Rescue Plan was one of the first actions I took as a senator. But as great as that percentage is of eligible vaccinated Californians, we still have a long way to go, particularly when it comes to protecting our kids and to help get them back to the activities that they love, like play dates with friends and visits to grandparents. So I speak today proudly, not just as a senator representing California, but as a father. Angela and I are raising 3 gentlemen. We don't say we're raising 3 boys, we say we're raising 3 gentlemen. And I know the pandemic has been especially hard on them for the longest stretch when they were on Zoom school. That was difficult. They couldn't wait to get back to school in person. They couldn't wait to start seeing their friends again, some of our extended family members. But they knew that in order to do so and do so safely, it wasn't just the distancing, it wasn't just the masks. As soon as the vaccines were approved, they knew that was going to be key to staying safe and healthy, but also for us to move towards the end of the pandemic and for schools to not just open, but to stay open. So it was a big day when our 2 youngest finally received their vaccines late last year. They were so excited they offered to buy us ice cream. And I did not say no to that offer. They got their shots in arms and have been breathing a little bit easier ever since. And it's not just my kids and the anecdote. Scientists have proven with months of careful research that the COVID-19 vaccine is safe and it is effective for kids. It helps protect against the life-threatening complications of COVID, like MIS-C, and it helps keep hospitals open and safe for children fighting other illnesses as the doctors here today will certainly share with you. I'm also proud, as I mentioned, to sponsor the PATCH Act to help deliver resources for pediatric hospitals which are facing major strains on their capacity because of the pandemic and major strains on their funding because of the pandemic. So today we're asking everybody watching to help, please help us by spreading the word. We need all eligible children to be vaccinated. You can help your family and friends by helping them make their appointments. Check who's eligible to get a booster for the best protection against new variants. Millions of Californians ages 5 and up have already been safely vaccinated with very few or no side effects. COVID vaccines are safe and incredibly effective at preventing hospitalization and preventing death. So let's make sure that everyone who's eligible is fully vaccinated, and let's do our part to end this pandemic together so our kids keep going back to doing what they love. And before I hand it back to you, if you'll allow me to say a few words in Spanish for our Spanish language audience as well. Doy la bienvenida a este anuncio tan importante y quiero comenzar con dándole las gracias a todos los doctores, las enfermeras y enfermeros y todo el personal que trabajan en hospitales y clínicas por todas las áreas del estado de California que están aquí con nosotros hoy. Mi prioridad desde el principio ha sido apoyar la recuperación completa de la pandemia de COVID-19. No solo como senador federal, sino también como padre. Estoy muy feliz de que mis hijos ya sean vacunados también. Ángela y yo estamos creando 3 niños, el más grande con sus 2 vacunas y su booster, los 2 más chiquitos que solo al fin del año pasado pudieron recibir la vacuna cuando se aprobó para niños de 5 años en adelante. Y compartieron esa felicidad de sus vacunas porque esperaron tanto tiempo para poder vacunarse y con esa vacuna, la protección de esa vacuna, poder regresar a las actividades que les encantan, como estar con sus amigos, poder jugar, poder visitar a su abuelo y estar con su abuela sin preocuparse del virus. Y por eso estamos aquí hoy, porque tenemos con nosotros bastantes expertos y médicos para compartir la información importante para padres de familia. Durante meses de cuidadosos estudios, los científicos han demostrado que la vacuna para COVID es segura y efectiva para los niños. Y la vacuna en verdad es la manera más efectiva, más importante para proteger la salud de ellos, la salud de nuestras familias y de nuestras comunidades. Así es que si no se han vacunado, sus niños no se han vacunado, por favor hagan su cita ya, vacúnense, vacunen a sus hijos y ayuda a su familia y amigos a hacer la cita para vacunarse también. Y así cada quien hace su parte para llegar al fin de esta pandemia. Thank you again to Children's Hospitals and the entire association for all you've done throughout this pandemic. And with that, Anne, back to you.
Thank you, Senator. With that, I want to introduce the panelists who are joining us for the discussion today. We've got with us today Dr. Grace Lee, Associate Chief Medical Officer for Practice and Innovation at Stanford Children's Health and Chair of the U.S. Advisory Committee on Immunization Practices. Dr. Kelly Mead, Interim Chief Medical Officer at UCSF Benioff Children's Hospital, Oakland. Dr. Carmela Sosa, Medical Director of Primary Care at Valley Children's Hospital in Madera. Dr. Patrick Frias, Chair of the CCHA Board of Directors and President and CEO of Rady Children's Hospital in San Diego. Paul King, Chair of the National Children's Hospital Association Board of Directors and President and CEO of Packard Children's Hospital at Stanford. Paul Viviano, President and CEO of Children's Hospital Los Angeles. John Bishop, CEO of Memorial Care Miller Children's and Women's Hospital in Long Beach, and Peter Baker, Administrator of Loma Linda University Children's Hospital. Just as an aside, we are leaving time at the end of the discussion for questions from attendees. So if you have a question you'd like to ask, please use the raised hand function at the bottom of your screen or type your question into the Q&A box. So to get started, Dr. Lee, I wanted to ask you, as we've heard, vaccination rates among children are still very low. Some parents may be concerned about the safety of the vaccine. What can you say to reassure them?
Well, thank you very much for having me here today, and thank you to Senator Padilla for this opportunity and for focusing on the health of our children in the state of California. And I am looking forward to the day when my children want to buy me ice cream. But I actually wanted to just share really briefly. I have the privilege to serve, as was mentioned, as chair of the U.S. Advisory Committee on Immunization Practices, or ACIP. It's a federal advisory committee that advises the director of the CDC on recommendations for use of vaccines authorized or approved by the FDA. Our committee has met 24 times in public meetings to discuss the benefits and risks of vaccines for adults and children in the context of multiple waves of this pandemic. And in addition, we have an ACIP work group dedicated solely to reviewing COVID-19 vaccine safety data in near real time across all our federal agencies. And I sit on that work group, and I chaired it before I inherited chair of ACIP. This includes the CDC, the FDA, the DoD, the VA, CMS, and Indian Health Services. And we have been meeting almost weekly, so nearly 50 times since the first vaccine was authorized for use in the US. And I share this because I want to emphasize how important vaccine safety is to our committee and to the US vaccination program. So in terms of what we know about safety, it's important to remember that we have administered 537 million doses in the US alone, 10 billion worldwide. And for the US, that means over 250 million people in the US have safely received a COVID-19 vaccine. Despite this, over 2/3 of our children 5 to 11 years of age remain unvaccinated, even though COVID-19 is the 8th leading cause of death for children in this 5 to 11-year-old age group. And these deaths and many of the hospitalizations we are seeing now in our own hospitals are preventable. Similar to the adult vaccine safety data we've been monitoring for over a year, the pediatric data continues to be reassuring. For mRNA vaccines that are available to our children, we see both local and systemic reactogenicity, so a sore arm or some mild fever, headache, or myalgias, that usually occurs within a day or two after vaccination and tends to resolve quickly. And these side effects really reflect your body's immune response to the vaccine. We've also seen extremely rare adverse events, such as myocarditis, though it seems to be occurring less frequently in younger children as we would have anticipated based on background rates. But when thinking about safety, it's really important to remember that safety doesn't occur in a silo. It really occurs in the context of the COVID-19 pandemic. So we know that children and adults who are either asymptomatic or have mild COVID-19 infection can go on to develop serious issues later. And Senator Padilla mentioned one of them, which includes MIS-C, or multisystem inflammatory syndrome in children, myocarditis, or other serious conditions. These serious adverse events are occurring far more frequently after COVID-19 infection than after vaccination. And in fact, vaccination has been shown to be 91% protective against MIS-C in children. We are also trying to better understand and describe the impact of long haul COVID, which has been seen in adults and also seen in children due to COVID-19 infection on children and their families. So as a reminder, we've given over 537 million doses of vaccine in the US, and we know that protection from vaccine is stronger and more reliable than protection from infection alone. So I'll just close with 2 quick points. One, as a practicing pediatric infectious disease clinician in our hospital, I can tell you we're seeing the highest number of children hospitalized with COVID-19 infection now, more so than any other wave of this pandemic. The vast majority of these children are not up to date on their vaccines or are not yet eligible for their vaccines. And finally, as a parent, I have vaccinated and boosted my own children to protect them from COVID-19 infection, to protect our loved ones, and to give them the confidence that they need to feel comfortable in school and in the community. I very much endorse Senator Padilla's statement. My children say they now feel safe and they can go about their business and get back to life. So we are very appreciative for the access to these vaccines. Thank you very much.
Thank you, Dr. Lee. Senator?
Thank you, Dr. Lee. Thank you, Ann. The next question is for Peter Baker from Loma Linda University Children's Hospital and John Bishop from Miller Children's Hospital in Long Beach. And the question is this: based on the vaccine clinics that your hospitals respectively have held in your respective communities, what are some of the strategies that you're employing to encourage parents to get their children vaccinated? What's been more successful? What maybe hasn't worked as well?
Senator Padilla, and again, thank you for your interest in this subject. Just to highlight the problem, currently we have 35 COVID positive inpatients in our hospital. Of that, 0 been vaccinated prior to coming here. And so it just highlights how significant this issue is and what your focus on this means. It is a problem. And for our clinics in particular, we view some of our most trusted individuals on this subject as our physicians. And so getting our physicians active and engaged in this process is probably one of the biggest things we can do. So some of the things we've done to engage them is get one-on-ones in our clinics and ensure that every visit they're talking to their patients about getting the vaccine. We also have an electronic medical record where we push out information, particularly on the vaccine and its efficacy, encouraging individuals to get vaccinated, especially our pediatric patients that meet the criteria. We've also been active with our schools. It's important to get our physicians in particular out to our schools, our high schools, our junior highs, and educate the community on the efficacy of it and allow them the opportunity to ask questions and really get them involved, as well as feature our physicians in our social media and our media events. So really for us, the key has been getting our physicians and our leaders, sometimes our pharmacists as well, active so they can speak educatedly on this subject to our community. And that's really what's helped us. I know John Bishop from Miller's has been doing a number of great things, and I know has some other comments as well on what they've done that's been successful.
Yeah, thank you, Peter. Trusted voices are critical. John?
Thank you, Peter. And I'd also like to thank you, Senator Padilla, for your continued support and advocacy on behalf of children's hospitals. We've employed multiple strategies in Long Beach. We're particularly fortunate to have our own Department of Public Health, and so it has been a team effort for sure. But social media has been one way that we found to be particularly effective to reach out and help educate parents, the decision makers in most cases, on the importance of the vaccine, the safety of it, how it protects their children, some information about what we are seeing in terms of vaccinated and unvaccinated hospitalization rates, and then also to protect others that they're going to come in contact with, their grandparents and others that might be immunocompromised. Our chief medical officer has also done multiple interviews with local media to help spread the word on the safety and the effectiveness of the vaccine, and has been presenting to local pediatricians and primary care physicians to help them with the tools necessary, not just to educate their patients, but to make them aware of city and other resources where vaccinations are occurring. Because we found that it really is a grassroots effort, particularly with some of the more hesitant populations. And in the vaccine clinics themselves, you do see some last minute hesitancy. And so we've had everything from pet therapy dogs to help soothe the children to our child life department, which these are employees that are trained in emotional, social, and educational support to help make those parents and children feel comfortable. And so it's really been a team effort, but it's an ongoing effort, and one that we're very fortunate to have such great partners in. So thank you for the time.
Well, thank you, Peter. Thank you, John. And before the next question, just want to comment based on what John shared. Look, obviously, we're here to promote the vaccines, but how we administer them, trusted voices, trusted community leaders, and doing it not just with shots in arms, but looking at the emotional well-being of the experience and information gathering too. That's great.
Yeah, absolutely. And I think for all parents, if you have any questions or concerns, please reach out to your pediatrician. That's clearly one trusted voice. I want to talk for a minute about COVID's impact on our local communities. We know that California is a large and very diverse state. I wanted to see Paul Viviano from CHLA, if you could maybe touch upon the impact that COVID is having on low-income communities and communities of color.
And thanks very much. And of course, Senator Padilla, thank you so much for your support of children's hospitals and most especially for the children in our communities that we serve. It's been well documented the impact of COVID on these groups, low-income communities and communities of color, have been disproportionately and severely been adversely impacted for both children and adults. From higher infection rates to greater morbidity and mortality, these communities have been harder hit, laying bare the structural disparity in quality and access to care. In the greater Southern California region, we are seeing vaccination rates that are similar to national rates, with vaccination levels being 20% lower among families of color. It's well understood that one of the most powerful tools to combat healthcare disparities is access to insurance and access to services. And we think this is especially true when it comes to COVID and kids. The overwhelming majority of patients cared for here at Children's Hospital Los Angeles are insured through the Medi-Cal program. Many of our children's hospitals that are represented here today have a majority of their patients who are also Medi-Cal patients. As a result, we all see ourselves as key partners in countering the systematic disadvantaged children and youth from these communities have in surviving and thriving despite COVID. We are doing this, all of us through our association are doing this through expanded access and education. Specifically here in Los Angeles, CHLA has been vaccinating parents and caregivers among families of patients now for more than a year. More recently, we've been able to offer vaccination clinics to patients and their families at our campus in partnership with the Los Angeles County Department of Public Health. We've administered thousands of vaccines in community settings, clinics, churches, schools, et cetera, in areas as diverse as downtown LA, South Central Los Angeles, San Gabriel Valley, and the San Fernando Valley. Through our partnership with Altamed, the state's largest FQHC, we have made testing available to traditionally underserved patients since the very start of the pandemic. We have vaccination campaigns underway in multiple languages through partnerships in diverse communities across Los Angeles. Children develop community contacts. And so in addition to creating avenues for access to vaccination and testing, we have been a supporter and active partner in many school districts throughout Los Angeles County, as all children's hospitals have been. Looking ahead, we are increasingly focused on getting more children who are eligible vaccinated, preventing the need for them to come in for care as a result of COVID. We are certainly looking forward to the opportunity to serve more children and to prevent the downside of patients and families of color and disadvantaged communities so that they can get vaccinated and thrive in this challenging time. Again, thank you very much.
Senator?
Thank you, Paul. Good to see you again, although it is virtual. We'll see each other again soon. Our next question is for Dr. Mead in Oakland. And the context for this question is really thinking back to about a year ago. Seems like so long, but in some of the toughest days of the pandemic, when it seemed like all of us were tracking case numbers on a daily basis and learning what positivity rates meant and what hospitalization rates meant. We've certainly come a long way thanks to the vaccines, but can you tell us what the status is of pediatric COVID patients in your hospital now? You know, at the beginning of the pandemic, it was not really affecting children that much. It was mostly adults, older, those with underlying conditions. Things got better as vaccines were deployed. Then the Delta variant threw us a curveball. Things started to get better again after that, than Omicron. But today, what does it mean for your pediatric patients? And as of now, what's the protocol for treatment, for therapeutics and care?
Thanks, Senator. I really appreciate this opportunity and the opportunity to speak about how our kids are faring, particularly in the hospital setting. I'm a general pediatrician by training, sitting in the C-suite of an acute care children's hospital. And last week, we saw by far the highest peak during the entire pandemic of kids admitted for COVID. Approximately 10% of our beds were occupied by children with COVID. Now, about half of those kids were admitted with COVID, and half of those children were admitted for COVID. And those admitted for COVID tended to be younger, not yet eligible for the vaccine, under 5, or not yet fully vaccinated. We also have children with serious comorbidities, other medically complex disease that puts them at increased risk. So that's really our focus right now. Thankfully, we think most of our kids had COVID with the Omicron variant, and we've been working with our county partners and local epidemiologists to understand more about the therapeutics, and I'll talk about that in a minute. And thankfully, with Omicron, we've had a lot of short stays of patients, young children admitted on the regular ward as opposed to the ICU. Now, we're not done. Hospitalizations tend to lag behind the case numbers, and they also tend to lag for the more serious hospitalizations. And so we'll see what the coming weeks bring for us. Right now, our census has remained steady in the ICU of 1 to 2 patients a day. And I can happily report for the first time in a while, we do not have any patients on a ventilator. We hope we're on the downturn of this surge, and we hope that it's good news for our patients. I'm going to kind of pivot now because you had a second question around therapeutics, and we have developed a protocol for therapeutics for children. There are options. Most of them are for 12 and above, especially that work for the current surge. We have IV intravenous monoclonal antibody therapies, and we have oral antiviral medicines, much like you might take for the flu. And we're really thankful to be on allocation with our county and state partners to get supply. The supply is not quite meeting the demand, and that's been a challenge for us. And I think we hope in coming months we'll be able to treat more patients who need these therapies. There are also a lot of logistical issues to get the right therapeutic to the right patient, as there's lots of considerations. We're really lucky to be at a children's hospital where we have infectious disease experts trained in pediatric infectious disease, much like Dr. Lee, and we rely on them heavily to help allocate the medications based on prioritization. So among those logistics, we look at the patient's age, we look at the vaccine status, we look at their medical complexity, we also look at their body mass index. They need to be sick enough to be at risk for severe disease, but not quite sick enough to be in the hospital, as most of these are indicated for outpatient. So we're working through those logistics. I speak daily with our subject matter expert in infectious disease, Dr. Singh, and ultimately, I want to say the best therapeutic is really a vaccine. It's easy to get, and our patients that get them tend to not end up in the hospital. So that's our mission, and we work with community partners and schools, and pediatricians are talking to their patients daily to convince folks to get vaccinated. So thank you for the opportunity.
Thank you, Dr. Mead. I want to draw Dr. Sosa into this conversation. Dr. Sosa with Valley Children's Hospitals. Many children are predicting that the current Omicron surge will peak or has just peaked in California. But once we're past this surge, what are the long-term impacts that you think we'll see with children?
Sure. Well, I'd like to join the group in just thanking you for this opportunity to speak. And to speak about the long-term effects on children, it's a little bit of a tricky question because I don't think we will know definitively for many years what the outcomes will be. That said, the Omicron surge may be peaking, and I think we're all very hopeful, as was previously mentioned, that we are on the downtrend. And also, as was mentioned, if we think back to that initial surge, children really made up a very small proportion of those who were infected and now make up a much more significant number of cases. And it's likely we will continue to deal with COVID surges for some time as new variants are emerging. So with each surge, though, in terms of long-term impact, we have seen the lives of children really significantly disrupted, really only to think that they're returning to some sort of normalcy and then going back to another period of chaos. And we as pediatricians, and certainly those of us who are parents, understand the importance of routine and predictability for children. From the preventive health standpoint, as a general pediatrician, I've seen that many families have postponed and continue to draw out much needed healthcare services due to fear of COVID exposure, particularly for those who are not eligible for the vaccine yet. And this is included, but is definitely not limited to immunizations, delaying of developmental and other important screenings, in addition to maintenance of chronic disease. And what we do know from the literature is that delayed care leads to worsening of chronic disease, delayed diagnosis of new disease, and an increase in morbidity, and unfortunately, even in children, an increase potentially in mortality. With respect to COVID itself, we have seen and continue to see children with extended periods of COVID symptoms, what was referred to earlier as the COVID long haul. And of course, MIS-C, which was also previously mentioned, is another pediatric entity whose long-term effects really are still to be determined. The one thing that is definitely clear is that our children's social, emotional, and educational experiences have been entirely disrupted and have left an indelible mark on their health and well-being. We've seen multiple disruptions in their education, prolonged periods of social isolation, limitation of those activities that allow for physical and emotional outlets, and not to mention the unprecedented loss of family members and loved ones. And all of these really have resulted in a perfect storm of sorts for our children of stress, anxiety, and trauma from constant uncertainty and change and loss. And because of that, we all, in terms of children's hospitals and pediatricians, have placed a focused effort and importance on children's mental health. Because we will likely see new surges for some time, it's really important that we continue with vaccine development and making vaccines and boosters available and accessible really to all eligible children. And I just wanted to say thank you again for the opportunity to share.
Thank you, Dr. Sosa, and so much appreciate you raising the concern about mental health. My wife Angela is a mental health advocate, and so that informs my next question, which is for Dr. Patrick Frias. Just as we've discussed the short-term, mid-term, longer-term physical effects of COVID, can you talk about how COVID is impacting children's mental health and what we need to be mindful of in the short-term, mid-term, and long-term?
Absolutely. And thank you, Senator Padilla, and to your wife as well for recognizing that there is no health without mental health. And unfortunately, throughout this pandemic, it has had a significant impact on the mental health and well-being of the children that we all serve as a community. In fact, taking the factors like school closures, remote learning, and not just that, but it's canceling sports, extracurricular activities, and then also family members who are ill and worried about potentially their own illness or mortality. That absolutely impacts. And with that, we've really reached a mental health crisis, not just in our state and our community, but nationally. In fact, children's hospitals nationwide, we've seen a 14% increase in mental health emergencies for kids in the last year. And when you look at kids ages 5 to 17 compared to 2019, and in the first half of 2021 alone, a very staggering statistic is that reports of self-injury and suicide attempts in children arriving at children's hospitals, emergency departments, were up 45% from the same time period in 2019. And I'll tell you that here in Southern California at Rady Children's, it's been no different, and my colleagues will say the same on the call. We've had our patients arriving in the emergency department is up 24% from the beginning of the public health emergency. And that steep and abrupt increase is also on the back of we're super busy. We're capacity stretched and strained, and now we're seeing this increase in the mental health crisis and pandemic. And that's not new, however. If we go back to pre-pandemic in 2011, at Rady Children's, we saw 163 kids in our emergency department with a mental health crisis. Fast forward to 2019, we saw 3,000. That's a 1,700% increase. And now, like I said, 24% higher just through this pandemic and likely not to go away immediately. So this crisis, we've all put in significant investments to address all the needs of the kids and build capacity for our community. In San Diego, it's things like integrating mental health into primary care, growing our outpatient psychiatry clinics, advancing our mental health urgent care. We actually opened a psychiatric emergency department during the pandemic to help offload, but still need more capacity. We have opened a crisis stabilization unit and advanced our inpatient psychiatric unit. And we'll continue to partner across our region and bolster these investments and services to care for all the children and families that we serve. And again, I know my colleagues will say they're doing the same across our community, and we're all doing our best. The fact is we need help to meet these needs. And if you maybe say, what kind of things could we use? We need support and training that next generation. We do not have enough pediatric mental health workforce. I'm sure your wife can attest to that as well. We need help with Medicaid reimbursement. It's not at parity with Medicare or other levels. And as Paul Viviano stated, most of the kids we serve are actually on Medi-Cal. So we need help being able to advance opportunities to see them. And we need to extend the flexibilities in telehealth, because we found a lot of kids we've been able to serve through telehealth through the pandemic, and that's not going to go away, fortunately. So we need help with the flexibilities. And lastly, in keeping with today's conversation, we need the kids to get vaccinated and their families to be vaccinated so we can all get out of this and go on to some semblance of normal life. So we're very grateful for you and the attention that you've put on this, and we look forward to working with you in the future. Thank you.
No, I appreciate that, and couldn't agree more. Trust me to help amplify the need for additional resources, for services, for workforce development, as you mentioned. But a lot of it also begins with undoing stigma and overcoming a lot of misperceptions about mental health, and letting people know, hey, it's okay to not feel okay, and encourage people to reach out and get the support and assistance that they need. After all, it's one body. Whether there's something happening with your leg or a lung, this happens to be the brain sometimes. So there should be no stigma in part of our collective challenge in responding to COVID and all the stressors that it's created. So, Anne, back to you.
Thank you, Senator. I think now we've left some time for questions from attendees. So I'd like to encourage people, again, if you've got a question, you can type it into the Q&A box, or you can use the raised hand function on your screen.
Thanks, Anne. Hi, everyone. This is Edgar with the Senator Padilla's office here. We have a couple of questions. As a reminder, if you have any questions on topic, please use the Q&A feature on Zoom. So the first one we'll take is from Araceli Martinez, the reporter with La Opinión. Question is, in addition to getting vaccinated, what other preventative measures should parents take to protect their children, especially those for whom there are no vaccines? And the second part to that question is, do you have the number of children currently infected in California since the pandemic began, and how many have passed away because of COVID? And I think I'll let you, Anne, answer that question first, if you like.
Sure. I was actually going to ask Dr. Lee if she has some, or Dr. Mead, if they have recommendations for other things that parents can be doing to help keep their children safe.
Sure. So as many of you know, we considered protection of all of us, including our children, as a layered protection strategy. And it's really important to remember that vaccination is probably the best and most reliable layer of protection we can provide. But there are additional measures that all of our schools have been putting in place for our kids, such as masking, which has been really important, and particularly because we know that vaccines are not yet available for those under 5 years of age. In addition to trying to ensure that there are other strategies the school uses, combinations of testing, cohorting, social distancing, trying to keep, and we are fortunate in California that we can keep a lot of things outdoors as much as possible. So, I do feel blessed that the state of California has done a phenomenal job, and our schools have really, also, much like the healthcare system, I just have to comment, our teachers and our educational staff have borne the brunt as well of being on the front line, and anything that we can do to help support them and to ensure that we are providing a safe environment in schools, in healthcare settings, and in the community together. All of that helps to keep our schools open for those who either can't get vaccinated because they're not eligible, or who perhaps are immunocompromised and don't respond well to vaccines. So that would be my 2 cents. Thank you.
I'll just add in there. Thank you, Dr. Lee. We worked with many pediatricians with local school districts to talk about the Swiss cheese model of disease and all the layers of prevention that are required, starting with vaccines, masks, hand washing, social distancing, cohorting, all of the things we've been talking about. And many of those layers put together add up to protection. But again, vaccines really go a very long way.
If I can just add one thing, Anne, before the next question. Thankfully, school districts and schools have continued to improve upon their testing and tracing protocols. So we also need to do what we need to do, from masking, sanitizer, et cetera. Testing is helpful. Increasingly, folks are taking advantage of the home tests that are available. And one of the things that I've heard is there may be a lot of people who, if they get a positive test at home, may not be reporting it. So sharing that information with your doctor or your health provider is important, so that collectively that data helps policymaking, resource allocation decisions at all levels.
Great. Thank you for reminding us of that. Also, in response to the question about the number of deaths from COVID among children, the CDPH website is reporting 49 deaths since the beginning of the pandemic.
Thanks.
Next question. Yeah.
Next question comes from Mr. Perez from KPBS in San Diego. Question is two-part again. You know, this event is about spreading information for vaccination, but how do your hospitals combat disinformation, which is keeping parents from getting their kids vaccinated? And the second part is, what do you say to those parents with children under the age of 5 who are medically fragile or who aren't eligible yet for vaccination?
I'd like to ask Dr. Sosa if she would like to respond to the second part of that question.
Sure. Let me see. That question is for those. Number one, continue to take all of those steps that were talked about in, actually, that's not number one. Number one is to get vaccinated for parents, all the loved ones who surround that child who cannot be vaccinated. Number one, get vaccinated. But yes, continue to take all of those steps that were talked about by Dr. Lee, Dr. Mead, in terms of that Swiss cheese model. You want to put up as many barriers as you can to prevent your child from being exposed. But number one, far above and beyond, is get everyone who is eligible around that child vaccinated and boosted.
And I think in terms of the question about misinformation, I think the best thing that we can really encourage as our parents, if they have questions, is to really reach out to a trusted healthcare provider. We know that, you know, parents have relationships with their pediatrician, and they may also have a relationship with the hospital. You know, to reach out and really communicate to a trusted source, right? And we want to encourage parents to do that. I mean, I think as you heard earlier from some of the other speakers here, you know, we are trying to work through all of our community partners, whether it's clinics, schools, other local community-based providers, because we really feel like it's kind of boots on the ground, and we are at kind of that final mile, right? That final meter or whatever, where we really need to be reaching out to people locally and communicating and connecting people locally to try to really meet parents where they are and address the concerns that they have when they have them. Next question.
Thanks, Anne. Next question, and I think this could be the last question here before we wrap up. We have from Emily from San Jose Mercury News. You know, can you talk about how the pandemic has affected your non-COVID work? You know, have you had to cancel any elective surgeries or whatnot? And how are you dealing with staffing challenges as you meet demands?
Can I ask Dr. Frias maybe to take that question to start?
Sure, absolutely. So with regard to non-COVID, that's a great question, because the majority of the kids that we're seeing in the hospital do not have COVID. And that work goes on, and it's been we had a delay, like all my colleagues will say. The flu season was delayed, and flu and RSV and all those things we didn't see a year ago, we saw in full force here over the last several months. And then when the current surge of Omicron came on, that was just a double whammy on top of it. I would say we don't have a lot of elective procedures in elective surgeries in pediatrics. What we would call them are probably non-urgent. They can be delayed a bit. And yes, we did get to a point over the past few weeks where we were selectively delaying a few of the cases that were non-urgent and could be put off at the discretion of the providers to ensure that the children were receiving the care that they needed. We were able to staff all of our units. It has been tight. You've heard a lot about in the workforce. We're all faced increased price for travel nurses and contract labor, and then the issues of being able to staff when you have your own staff that are out with Omicron. And that has been a challenge over the last several weeks. We have seemed to be cresting and getting past the worst of it now and are moving forward.
Thank you.
Thanks, Anne. And Senator, we just have a quick off-topic question here for you. You know, as a member of the Senate Judiciary Committee, what are you hoping to see in President Biden's upcoming nominations to the Supreme Court? And do you agree that the president's commitment to nominate a Black woman? And then after that, you can go ahead and just give final remarks, and we should be good to end the program.
Good, sure. Not quite on the topic, but equally important. Wholeheartedly support President Biden's commitment to nominate a Black woman to the Supreme Court of the United States. I am a member of the Judiciary Committee, where The initial confirmation hearings will be scheduled, so I'm not weighing in for any particular individual, but I do know the president's gotten a lot of more than qualified, more than capable, talented women, Black women that fit that profile, and I look forward to the process when it comes. I'm sure it's just a matter of weeks, a couple of months at the most. Opportunity to make important history here for the country. But back to the topic at hand, back to the vaccines. Just in closing, just thank you all again for participating today. We hope that you all have either learned something with the information that has been shared, or are reinvigorated to help us spread the word about the importance of vaccines for everybody, including children ages 5 and up. One more time, anybody out there who has been vaccinated, thank you very, very much for doing your part. And if you haven't, don't wait. You can make your appointment now. Vaccines are free, they are safe, they are effective, and the best way to protect your health, that of your family, that of our community. If you are vaccinated, know somebody who hasn't, you can help them by finding them a vaccination location and helping them make their appointment. So let's all do our part and get to the other side of this pandemic. And thank you so much for your help in organizing today.
Thank you, Senator, so much for your participation. And thank you to all of the attendees and presenters today. Really want to encourage everybody present to help us get that last piece and get all of our kids who are eligible vaccinated, and helps keep our community safe. So thank you so much.
Stay safe, everybody.
Thank you again. Take care.